Dr. Barrett, a patient's chief complaint is I hate my side profile in photos.
Okay.
All I see is how soft my chin looks. What's the fix?
You know, as a plastic surgeon, we're kind of trained to identify certain facial proportions. What's the fix? You know, if it's a soft chin, I mean, let's look at it. Is it a soft chin? Is there a lot of fat there? You know, do we need to do Botox? Do we need to debulk it? What's really going on? Most likely it's a retrognathic chin, meaning that it comes back behind the lower lip. If you draw a line here and the chin is kind of way back here, maybe because you didn't breastfeed or you didn't have hard foods, you had all baby food as growing up as a kid and your chin is retrognathic, that could be considered a soft chin, and that combined with excess neck tissue really gives it kind of a weak appearing chin. It actually can have some airway issues and stuff like that. So there's ways you can actually improve that. I would say the easiest way is to do a chin implant and neck lipo. That's a great fix for the majority of people, but for people that really severe chin retrusion, you might actually want to undergo orthognathic surgery where they actually extend the jawbone out. Although there's some risks with that, you can paralyze the nerve and stuff like that, but for most people, a soft chin means we can do a chin implant and neck lipo and save the day.